This X-ray image and this one are of the elbow. But they look different. This image shows the anatomy of the elbow while viewed from the front. This image shows even more detail in anatomy, which could be missed if only the first image is used. Differences in the body anatomy seen in the image are observed when the X-ray projections change. X-ray projections describe the path of the X-ray beam as it passes through the body region of interest. However, it is important to note that projections are different from positions. Patient positions describe the physical stance of the patient. It could be lying down, standing, or turned 45 degrees. It is quite important to determine the projection used in an image for proper diagnosis. Let's talk about the various projections used. AP, short for anteroposterior projection, describes the X-ray beam that enters the front and exits the back of the anatomy of interest. This means, for AP projections, it's always the posterior side of the anatomy in contact with the image detector. This projection is commonly used on patients lying down in bed, or for imaging the spine and pelvis. A common case is when examining the chest using the AP projection, in which the heart appears 18% larger than it is. This is why AP chest X-rays are taken in emergency situations only. PA, or post-anterior projections, define the path of the X-ray beam entering the back and exiting the front of the anatomy of interest. In this case, it's always the anterior or front of the anatomy in contact with the image detector. PA projections of the chest are most commonly used when examining the chest. This is because the heart appears with its approximate true size, thus limiting misdiagnosis. Frontal views flatten the body. Structures that are separated in depth are forced to overlap and appear as one. That's why lateral projections exist. A lateral projection is taken when the body is placed sideways to the detector, restoring depth. Lateral projections describe the path of the X-ray beam passing through the region of interest, from side to side. Instead of everything overlapping from front to back, structures separate along the anterior-posterior axis. It is important to note that lateral projections can be taken from one given side to the other, or vice versa. This applies to the chest, to joints, and to many other regions. The lateral view doesn't add information. It reveals information that was already there but hidden. Some projections are designed not just to show structure, but to show movement. The lateral decubitus projection is one of them. In this position, the patient lies on their side, and the X-ray beam directed horizontally to the region of interest. Gravity now plays a role. Air rises. Fluid settles. This allows us to visualize things that depend on movement rather than shape. It is important to understand how lateral decubitus projections are named. We use right or left to describe which side of the body of the patient is in contact with the receptor. For instance, this here is the left lateral decubitus projection because the picture illustrates a person lying on their left side. Dorsal and ventral decubitus projections are also used, in which the patient lies on their back or their belly respectively, and the beam is directed horizontally to the region of interest. The key point is this. The projection is chosen based on the question being asked. Not all projections exist to show anatomy. Some exist to reveal physical behavior. Oblique projections describe the path of an X-ray beam directed to the anatomy of interest, at an angle. They are usually taken when the X-ray tube is angled and a patient isn't, or with the patient at an angle to the detector, but the beam remains perpendicular to the detector. Oblique projections are often misunderstood. They are not random rotations. They are problem-solving views. When structures overlap on AP or lateral views, rotation can separate them. By rotating the body or limb, we change how anatomy is superimposed. This is especially useful in joints, ribs, and complex regions. Oblique projections exist to answer a specific question. What is hidden when structures overlap? Therefore, the body does not change. Only the perspective does. It is also important to understand how oblique projections are named. Naming is based on which side of the anatomy is closest to the detector. For instance, in this illustration, this is an anterior oblique projection because the anterior side of the anatomy is closest to the detector.